He felt every cut, but couldn't scream. He lay there on the operating table, helpless, yet in excruciating pain. This is the story of the man who was awake during his surgery. It all starts in a town called St. Louis, the gateway to the West. The year is 2020, and medicine has come a long way. From weird practices such as lobotomies to cure mental illnesses, trepanning where holes were drilled into the skull to release evil spirits, and even tobacco smoke enemas to help victims that had drowned. You definitely did not think this would happen in the 21st century. The month is July, and a 44-year-old man working as a truck driver was scheduled for an operation. He had a couple of reviews, and the surgeon had informed him that he needed a procedure. He told him there was nothing big to worry about, as he had performed this procedure many different times. Having lived an unremarkable life, the man suffered from a condition referred to as a hernia, where an organ of the body protrudes outside its containing cavity. This condition is actually quite common, and several thousands of procedures are done weekly to correct the defect. The surgical procedure is done in the operating room, where general anesthesia can be used, which involves several drugs that knock you unconscious and block pain signals from reaching your brain. The man checked into the hospital early that morning. He cracked a few jokes with the nurse, trying to mask a layer of anxiety. After all, surgery is always a little nerve-wracking, even for something as common as a hernia repair. He signed all the necessary forms: anesthesia consent, liability waivers, and standard procedure. The anesthesiologist briefly explained how general anesthesia worked, reassuring him that he would be completely unconscious. No pain, no awareness, just a smooth sleep until recovery. But as he laid on the operating table, heart slowing from the drugs coursing through his veins, something went wrong. It started with the sound, the faint humming of the monitors, distant voices, then pressure. He felt the scalpel drag across his abdomen. It wasn't sharp, not at first. It definitely wasn't something he had felt before. More like being carved open with a dull blade. Panic surged inside him. He tried to scream, but the body didn't respond. Hearing everything that was going on in the operating room, the discussions between colleagues, snazzy comments being thrown around the room, he thought to himself, definitely someone has to notice that I can feel this. But he couldn't move. He couldn't speak. He couldn't even open his eyes. He was paralyzed, fully aware, but locked inside his body. The medical team was none the wiser. To them, he was asleep. The surgery continued. Each cut, each probe, each stitch was excruciating, and he lay there for a while screaming in pain, but with no hope and no help. He thought to himself for a moment, this was supposed to be a routine surgery, but why does it hurt? Why can't they make it stop? Please make it stop. He screamed on the inside, but like a dim light in the forest, no one could see. But what exactly was happening here? This phenomenon is known as anesthesia awareness, a rare but real occurrence. General anesthesia is supposed to render you unconscious. It uses a cocktail of medications, some to sedate, some to paralyze, and others to block pain. But in rare cases, typically 1 to 2 per 1,000 surgeries, a patient may regain some level of consciousness during the procedure. Some experience vague memories or sounds. Others, like this man, fill every moment with harrowing clarity. It's more likely during high-risk surgeries, emergency procedures, or when low doses of anesthesia are used to prevent complications. But this wasn't the case with this surgery. This was different. It certainly felt different for the man. It was rumored that there was a delay in administering the anesthetic gas, leaving him vulnerable to feel every moment of his surgery. The man's ordeal lasted several minutes, but it scarred him for years. After the surgery, he told the nurses what happened. Some doubted, others were stunned. Perhaps he's just lying to us and just wants attention, they murmured to themselves in their break room. In the weeks that followed, his physical wounds healed quickly. The hernia repair was a textbook success, but his mind was a battlefield. He struggled to sleep, afraid that every time he closed his eyes, he would return to that cold operating table. Therapy sessions later began. First once a week, then twice. Slowly, he began to speak about the experience without shaking or breaking down. A psychological evaluation confirmed he was suffering from post-traumatic stress disorder, also known as PTSD. Nightmares, panics, fear of sleep. The surgery had changed his life, not because of the hernia, but because of the trauma it caused. The therapy helped, eventually, but he never forgot what happened when his voice was taken away. He went on to file a lawsuit against the hospital for his experience. As of now, there is no publicly reported outcome confirming whether he won or lost the lawsuit. The case was filed against Washington University, the anesthesiologist, and the nurse anesthetist involved, and medical records acknowledged the delay in administering the anesthetic gas. However, updates on a settlement or court ruling haven't been made available. This is because legal proceedings like this can take years, especially when medical malpractice is involved. So what hope is there for us? And better yet, how do we prevent this? Modern hospitals use sophisticated systems to monitor depth of anesthesia. BIS monitors can scan brain activity. Vital sign trackers detect spikes in heart rate and blood pressure, which are possible signs of awareness. And customized drug protocols have been put in place to help balance sedation and paralysis. But still, human error, equipment failure, or unusual reactions to drugs can lead to lapses. If you're preparing for surgery, talk to your doctor, talk to your anesthesiologist, share any history of unusual reactions or sensitivity. This man's story is a chilling reminder of how medicine, despite its progress, can still fall in the most personal ways. If you've experienced something similar, you're not alone. Share your story in the comments, and if you found this video eye-opening, consider subscribing. We share medical stories that educate, inspire, and sometimes shock. Because the more you know, the less helpless you ever feel.